All right, it's really interesting. If you get to have an idea of all the things
I knew
behind
you were going
the
to
camera.
say it.
Oh yeah, it can be so interesting, I would
about.
say. All right, now Nigeria is a major contributor to the economy of countries like India, US, and many others due to medical tourism.
Indeed. Well, the poor quality of healthcare in the country has forced many to seek alternative help outside of its shores. It has been said that Nigerians spend about $1 billion annually on medical tourism.
Now, many Nigerians have lost faith in the country's medical sector due to a failing health system. From dilapidated infrastructure to lack of necessary medical equipment and treatment facilities, as well as dearth of medical professionals, the sector leaves much to be desired. Absolutely.
So many challenges bedeviling the Nigerian health sector. And what kind of attention is it even getting from the government every year? You know, due to the kind of budgetary allocation it gets every time. Well, we have a pharmacist in the studio, Dr. Dolapo Wakpovwe, to talk to us about that. I hope I got the name correctly. Wakpowa. Okay, so the E's not, they're supposed to be okay. Thank you for joining us anyway.
Thank you.
Yes. We understand that Nigeria has about, in document, about 72,000 or thereabouts medical practitioners, but about half of them are working abroad. How did Nigeria get to that point?
Well, the first thing is this. When we look over the years, we discover that our emphasis has shifted from healthcare. We started off at independence with 40 million Nigerians. Today, we're arguably 180 to 200 million. So it's expected that the funding for the section should have increased appropriately. But over the time, we've discovered that healthcare just doesn't seem to be a priority of the succeeding governments. That's one of the reasons why we're here. We discover that we haven't actually enforced healthcare in Nigeria being a compulsion for people in governance. Everywhere in the world, you find out that the president gets medical help in their nation. But in Nigeria, we find most of our leaders go out for medical care. Therefore, the people are left at the mercy of whatever is available. So I think at the bottom of this, the first thing is this, that we must insist that people in governance get medical help in Nigeria. And that would begin to help them to appreciate the level of dilapidation we have in the system.
But I wonder who is going to champion that, because usually when the chief executive of the country certainly finds his way to enjoy medical tourism outside of his own country, this is not just this administration, it's been past presidents of Nigeria have enjoyed that. So who is going to champion that?
Well, you want to make a change, you start from where you are. So let's forget yesterday. If the government can buy the idea today, we can start from today and have a better healthcare tomorrow. And
that's what is in essence talking about, the will to want to, effect a change when you know that you are not even, helping the situation, as it were, as the #1 person, citizens rather, of the country. Now let's look at the African Union Abuja Declaration of 2001, where an agreement was made and African countries signed the agreement that at least 15% of the annual budget would be allocated to the health sector. And then we hear that a small country like Rwanda is allocating more than 15%, close to 20, even more than 20% to the health sector. But that is not the case in Nigeria. Nigeria is a signatory to that Declaration of 2001. How does that make you feel as a practitioner in this sector?
Well, like we started out, it's the will. There must be a will of government to improve the healthcare. It's not even about allocation. When we look at Nigeria, sometimes the budget is delayed for so long that the impact of the budget is not felt in any sector. And the healthcare sector is a part of the global sector of Nigeria. So we have to start from there. We have to make things work properly. And if we just start by making the money, making whatever funds available at the appropriate time, then it makes planning, it makes effectiveness much more available. That's the first thing. The second thing is this. I don't think it's just about money. I think it's about the people caring about the masses. Healthcare is, when you think of health, it's something about care. If you don't care, you can throw money at anything. So the people governing the money, the people in charge must care about the Nigerian populace.
All right, even besides the Abuja Declaration of 2001, there was also the Abuja Plus 12 meeting of 2013, which was meant to, one way, review the Abuja Declaration and see how areas that were not met can be fine-tuned and maybe put forward better. But from all of these meetings where African heads of states gather in Abuja and then they decide on what to do and strategies and all of that, how are we on track? Is Nigeria on track in getting to where you were talking about?
It even looks as if we haven't started. 40 years ago in Lagos, we had 2 major general hospitals, 1 children's hospital, and the others were health centers. And people got better attention because the facilities were well kept. We must have a will. The bottom line is we must have a will. We must have a will to provide good health care, good quality health care to the masses of the people. The fact is this: Nigeria is a wealthy country, and quite a number of people just go out for medical tourism. Therefore, the impact is not
Those
felt.
that can afford it.
Yes, quite a number of the people that are supposed to care, that are supposed to take charge of these things, they go out for their medical attention. So they don't even feel it. They don't feel it. If we're looking at the national picture, we also discover that the picture in Lagos is completely different from the picture in Nigeria. In Lagos, we've had quite considerable improvement in facilities, but it is challenged by the fact that the depreciation is all countrywide. Therefore, what happens is this: there's medical tourism to Lagos.
Exactly. And then it puts pressure on whatever is available.
Therefore, you can't. It's as if you can't get it right anywhere.
Okay, there's the problem of the developing primary health centers across Nigeria. We have thousands of them, but how many of them are really functioning well? How many of them have, the basic structures that they're supposed to use to even operate? So the indigenous Nigerians are not even getting quality health care. There is the problem of the NHIS, which is supposed to be accessible to many Nigerians. It's not so. If you look at, again, Rwanda, it has a universal health coverage system where the poor indigents can get quality health care in any hospital in that country at a very small amount. Why is that not workable in Nigeria?
We have primary health care centers spread all over Nigeria. Some of them, most of them, are not functional. If you're going to improve things, you must make it. There must be a service available that makes people want to work in those places. It's not going to work for you to open a health center in the middle of nowhere, no facilities, and expect people, even the indigenes can't access those places. I mean, I've had reason to travel around the country, and many places the primary health centers are not even, they don't even function anymore. And in the places where they function, there's that of staff, that of equipment, and that of basic things like water. How do you run a hospital without water?
And even light.
It's mind-boggling.
All right. The last time Nigeria had it good in the primary health sector was when Professor Luke Ransom Kuti was Minister of Health. But we have to leave you here now, Dr. Dolapo Kwakwowi. Thank you so much for coming on the program.
Thank you for coming.
Thank you.
Thank you so much.